Well, I think we should start. Well, can I welcome you all to the Buddhist Society? This is in our series of public lectures which deal not entirely with the Dharma, but with sort of areas around it, which are cultural often, and in this case it's to do with health. The interesting thing about tonight's talk is that it's about really the way in which spiritual practice, the slowing down, the calming down, the concentration of the spirit affects health. Not just physical health, but also mental health, emotional health, and how it leads to an opening up of the body, the mind, the heart. And we're very lucky to have with us tonight Caroline Hoffman, who studied or did a PhD in mindfulness at the University of Southampton. She's a clinical and research director at the Haven Charity in Fulham, not so far from here, which provides award-winning breast cancer support centres across the country and provides mind-body approaches to help people affected by breast cancer. She commenced her own mindfulness practice over 20 years ago, and Caroline trained to teach mindfulness-based stress reduction, or MBSR, from a program at the University of Massachusetts in spring 2004. And she continued to teach MBSR to a wide audience at the Haven in Fulham, London. She has done a doctoral research and doing doctoral research evaluating MBSR in women with breast cancer, and has recently published an internationally renowned Journal of Clinical Oncology, which is one of those premier, top-flight academic journals. I think it was Kabat-Zinn, wasn't it, you worked with?
Yeah, that's right, John Kabat-Zinn.
Some of you will remember the name Kabat-Zinn. If you haven't heard of the name Kabat-Zinn, you may well hear about it from Caroline tonight. Yeah. But he sort of pioneered the mindfulness movement. I think he was originally at Johns Hopkins University. And
MIT. He was at MIT.
MIT, yeah. Caroline will say a little bit about that. Yeah. I don't want to take up any time from our speaker anymore. But thank you very much.
Thank you.
Thank you so much, Caroline.
Thank you very much.
Thank you.
So, thank you very much, Desmond. It's a great honour to be here speaking to you all this evening on a topic which is very close to my heart, and which is why I did my own doctoral work around this area. So when it came to doing a PhD, which if any of you have ever done one, is a real labour of love, it helps to choose a topic that you are passionate about, because otherwise you may never finish. So mindfulness was this topic for me, and through my own practice and experience of my own practice and development of my own practice and the research, it's really helped me. And I hope that I can, in this hour, share with you all a little bit of what I have found, and I hope that this might be of some benefit to you. So I'd like to start, if I may, by us all arriving in this moment. So I'd like you to take, if you would, a comfortable sitting position with your arms and legs uncrossed. I'd like you to ask you to take a position which embodies the idea of being present and being awake. So as we come to this moment, from whatever it's taken for us to get here this evening, let's start by arriving in the body. I invite you to be aware of the feeling of the feet on the floor. You may like to close your eyes or to lower your gaze if that's helpful. Being aware of the sensations on the soles of the feet. And then bringing your attention and awareness up through the body, being aware of the body sitting here on the chair. And just allowing yourself to experience whatever is arising in your field of awareness from moment to moment. Maybe noticing the support of the chair. Maybe noticing sensations in the body. Maybe noticing the coming and going of thought. Maybe experiencing emotion. Noticing how you experience any emotion that's arising in the body. Maybe starting to become aware of the breath, the movement of the breath in the body. Bringing the attention back to the awareness of bodily sensations, physical sensations, and maybe the awareness of the breath. Each time you find the mind has wandered away. Coming to rest in the present moment. And as best we can, allowing things to be as they are. With no pushing forward, no holding back, just dropping in to the nowscape, to what's happening in this moment. So now gradually coming back to the awareness of the room, opening your eyes, having a little stretch if that's helpful, and maybe in your own mind just evaluating your experience now as you sit here and how this bringing our attention to an awareness to the present moment has, what difference this has made to you just in these few minutes. So thank you for that. I'd like to just put a context to the work I do. And as Desmond said, I work at The Haven, which is a registered charity offering breast cancer support. We offer complementary medicine and psychological support. And the mindfulness programs that we offer are part of that support, and some of these programs are also open to the wider public as well. So we've taught over 1,000 people mindfulness at our various havens. We have 3 havens. And we also, I also run drop-in groups twice a month to help people have an experience of what mindfulness is about, or also to help maintain practice after they've finished a program of mindfulness. So let's start by asking what mindfulness is. I could spend the whole hour, in fact I could probably spend a lot longer than an hour, just debating and discussing this topic, but I think for now, I hope that your experience in this practice has, if you're unfamiliar to mindfulness, and I'm going to speak to you all as beginners, because I feel I am always a beginner in this practice. always coming to the present moment as if for the first time. So as we explore the practice in the moments that we practice, we may describe mindfulness as a way of being aware and awake to the present moment. It is a continuous practice of touching life deeply in every moment of our lives. And when we are able to be more present, more mindful, more aware, we can be more at one with ourselves, with people around us, and also with whatever it is that we're doing. So the second bullet point are just the words that I find, for me, are particularly helpful in thinking about the practice of mindfulness, which is about an intention. So I make an intention to be present, to be aware, to be awake, to pay attention, to be embodied. This mindfulness word is a bit of a red herring because it's not just about the mind. You know, we can only be fully present if we're embodied. And no matter what problems we have with our bodies, you know, we all have all sorts of problems with our bodies, but this body is still a wonderful vehicle to help us to be grounded, to be present. Another aspect of mindfulness which is very important is this idea of an open-heartedness, a spaciousness that comes into the practice, an accepting and allowing of whatever it is that's arising from moment to moment. And this aspect of the practice is incredibly important because our minds are so quick to jump in. You know, you may have noticed in that short practice how our minds wandered off, what popped in. And even at a very subtle level, oh, I'm practicing mindfulness. Oh, you know, isn't this great? You know, all these little thoughts, they jump in the whole time. You know, it doesn't matter in the sense whether it's we label it a good thought or a bad thought. That's not important. But, you know, the mind is very, very subtle, and it comes in and affects our ability to be fully present. So we are, through our practice, we are training ourselves, and what we are now learning in the practice of mindfulness is that it is actually changing the structure and function of our brains. And there's some wonderful work going on, particularly in America, by Dr. Richard Davidson at the University of Wisconsin, where he is, with his team and other teams in America, scanning people, either long-term meditators or before and after or during meditation, seeing which parts of the brain actually are affected, seeing how our brains change and therefore our behavior changes and our attitudes all change as a result of this practice. So it's a really exciting time to be involved in exploring this practice of mindfulness. So we can move from our old habitual patterns, old mindset, which I often think of as a bit like, you know, we have the stylus on the... Looking around the room, I'm glad to hear a lot of you will be familiar with old records and stylus on the record, and the idea of the thoughts just going round and round like a record, you know, stuck in the groove, as we used to say. So this whole idea of being caught with our minds and the opportunity that coming back to the present, coming back to the body, the opportunity that gives us with this practice in helping to enable us to see more clearly and to be more awake. The Chinese character, I understand, is a combination, not being a Chinese scholar, in fact not really being much of a Buddhist scholar, so I put my hand on my heart to say that. Happy for any questions later. But just to say that this character, so when we're looking at mindfulness, we're looking at presence, and we're looking at the mind and the heart. So it's not just it certainly isn't a head thing. In fact, we're trying to step out of that as much as we can often, that thought we get so caught up in. And as we've been told, you know, by various scholars, that mindfulness can be considered the heart of Buddhist meditation. It's one way of viewing it. So in the description of mindfulness, there are foundations, if you like. When I think of this often as, if you like, coming to our senses, because in terms of the practice of mindfulness, you know, we use all of our senses and the mind in order to be present. And that's the essence of the practice. So how can we do this? And the first way is really to start with the body. And we can learn to practice to be more in the body when our tendency is to be in the head. And it's a kind of a, in my experience, except for a few people I've met who seem to have a more natural tendency to be in the body, many of us seem to be more naturally in the head for, you know, whatever reason, whether we've been brought up that way and so on. So we look at mindfulness of the body, and we can also move to mindfulness of emotions, and mindfulness of thoughts, and mindfulness of our sort of mental landscape, and also mindfulness of the thoughts that come through it. So there's many different ways to be mindful. I often describe the mindfulness practice as like a triangle of awareness. If you think of a big A for awareness, and the thought, in a sense, we have physical sensations at one corner, we have emotions at another corner, and we have thoughts in another corner. And then we have our kind of behavior, which results out of all of that. So we have these three sort of cornerstones, if you like, that as we go through, we can start to be more aware of these individual elements. Because unless we break down the practice of being present, it's very easy just to get caught up in a sort of an amalgam of things, and being more specific and directed with the practice, I have found as being incredibly helpful. So I'd like to, I hope you're happy to practice. I haven't really kind of asked your permission, but I hope, because I feel that I can talk for an hour, but it will be more useful to give you an experience, or some little experiences. So this, every time we have the water lily or the lotus flower, whichever you like to call it, comes up, we're going to do a little practice. So I would like to invite you again, just to, this time, if you're comfortable to stand, I'd like to invite you to stand. If you prefer to sit, please stay sitting, because what I'm going to do, we can translate into sitting. So please don't stand if that is not right for your body. When we come to mindful movement, which is what I'd like to do a little bit of you now, it's very much about our highest priority is listening to our own bodies. So we're not trying to force our body to do anything which isn't natural to it. We are only we're exploring mindfulness in the form of movement. That's what we're really doing. So the invitation is just to only move to the extent that feels right for you, okay? And that will be different for everybody. But it's a way of us exploring the different ways that we can be involved in mindfulness, which is lying down, sitting, and also in movement and standing. So let's come to, if you are standing, or even if you're sitting, that's fine. Let's come to standing with the feet hip-width apart, if that's comfortable for you, or sitting in an erect and dignified position. So having a sense of the feet being grounded and planted down onto the floor. Having a sense of lift up through the body. And allowing the shoulder blades just to slide down the back. So allowing the chest to be open but not to be forced. And allowing the head to rest on the shoulders. You may care to have the eyes open or the eyes closed, that's fine. Having a sense of the body standing here. Taking our attention and awareness into the body, or sitting if you're sitting, having a sense of the body sitting or standing, and just noticing what's happening as you do. So taking our awareness into the sensation. So in this sense, we can just be with whatever is. And maybe have a sense of connection with the planet, this beautiful planet we live on, through the feet, through the floor, having a sense of being here. and breathing. And as we stand and breathe, just noticing what's arising in the body. Maybe we've got some aches and pains. And if that's the case, let me invite you to take your full attention to that part of the body that's calling you, that's calling your attention and awareness. And breathing and noticing what happens when you take your attention and awareness to that part of the body. And if the body is quiet, if there's no particular aches or pains, then just being aware of whatever is arising for you from moment to moment. Noticing different physical sensations. Noticing the thoughts coming and going. Allowing ourselves just to be in this standing posture. Nowhere to go, nothing to do, and nothing left undone. Just here, right now. Inviting some ease into the posture, noticing where there may be a point of ease in the body, and just allowing that to be. I'd like to now invite you, if you've got your eyes closed, to gently open your eyes. And we're going to do some, because we're quite short of space here, I'd just like to invite you to do a little bit of movement, just to get a feeling of moving with mindfulness. So let's start by, if you can, just taking the arms up above the head gently, just as high as feels right for you. And lifting and breathing and feeling that stretch in the body. And if it feels right for you, just as a pussycat does, having that feeling of stretching one arm and then stretching the other arm. And as you do so, being aware of the sensations in the body and how this opening in the body feels as we do it. Only going as far as feels right for you, and feeling free to stop at any time, even to sit down if that is what your body needs. And breathing. And when you've done an even number of sides, then gently bringing the arms back down. And pausing for a moment and listening into the body once again. And just noticing how the body feels. Just noticing the effect of that movement on the body. And then if you care to, gently starting to move the shoulders, so lifting the shoulders up towards the ears and gently back and round, and taking our attention into the body once again, maybe into the shoulders if that's helpful for you, and noticing the sensations that are arising as you gently roll the shoulders around. Allowing the breathing to be natural, not having to do anything special with the breath. And then pausing for a moment, listening to the body. And then if you care to, taking the shoulders back the other way, so just rolling the shoulders in the other direction, just feeling how that feels in the body. And then gently coming back to standing once again. Breathing and just noticing how the body feels now. Does the body feel more alive? Do we feel actually more connected with the body? Even just having done this couple of movements. And then just inviting you to gently turning from the center of the body, gently turning to the right, turning to the left, just coming from the core, coming from the sort of abdomen, maybe widening your stance a little bit if that's helpful, even I know there's not much room, so we can't do too much, but just having that sense of turning this way and that, and just noticing how this feels in the body. Breathing naturally. So all the time paying attention to what's happening inside. Each time the mind wanders away, bringing it back. And then coming back to center when you've done an even number of sides. Breathing, checking in with the body again, noticing how the body feels. And then I'd like to invite you to sit down again. And this time, taking a comfortable sitting position where you can allow the body to feel as though it's supported, well supported, and that you can feel at ease in the body. So that may be sitting with the back against the back of the chair, it may be sitting with the back free, just however it feels right for you. And I'd like to invite you now we're going to gently take our attention through the body and just notice how the body is. So I'd like to invite you to start, if you care to, with the feet. Once again, bringing our attention back to the awareness of the soles of the feet. Breathing, noticing. Bringing the attention to the feet as a whole. So as we do this, I'm asking you to simply notice what's there. Anything that arises in your field of awareness, any sensations. Remembering that there's no right or wrong way to experience what we're doing. What we experience in the practice of mindfulness is what we experience. It's just fine however it is in that moment. We can take our hands off, we don't have to try and make anything happen. Coming to the ankles, breathing and aware of sensations. Bringing our curiosity to noticing what's there now. Maybe what we find in this moment isn't what we expect. Bringing our attention and awareness to the lower legs. Breathing and sensing. Gently escorting the attention back to the lower legs if the mind wanders away. Bringing kindness to ourselves in this practice. Noticing if we have any tendency to want to be hard on ourselves for the mind wandering, which we know it does quite naturally. So we gently bring the mind back. Bringing our attention to the knees. Being aware of any sensations arising in the knees. Bringing our sensations to the thighs, the outside and the inside of the thighs. Coming to the bottom, sitting on the floor, on the chair. being aware of the support of the pelvis to the upper body. Coming to the abdomen and the lower back. Breathing, noticing any and all sensations that arise on the field of our awareness. Coming to the chest, the upper back, breathing and sensing. Maybe noticing the heart, the area in the center of the chest. Maybe just noticing how that is in this moment. Coming to the shoulders, coming to the shoulders, taking our attention down the upper arms, breathing, sensing, aware. The elbows, coming to the forearms. Maybe asking ourselves, what's here now to be noticed? To the wrists, to the hands and the fingers. Seeing how closely we can be aware of just what's there in this moment. Then bringing our attention from the hands up to the area of the neck and the throat. Becoming aware of the head, the area under the hairline. Maybe noticing how the brain feels. And bringing our attention down over the face. Just noticing whatever's there to be noticed. Taking our attention to the body as a whole now, as we sit here. Aware of ourselves sitting, breathing, So now gently, when you're ready, coming back into the room, taking a moment to reflect on the quality of attending, the quality of the attention coming back to the present moment. how was it? Doesn't matter in this practice how many times the mind wandered. That's actually doesn't matter at all. How were we able to keep bringing the mind back when we noticed the mind had wandered away? So that's the quality of attending that we're developing gently in this practice of mindfulness. So just reflect without being hard on yourself, just how it was, because remembering how it was is just how it is how it is, so that's okay. So when we're practicing mindfulness, I mean, this is as I said, with mindfulness, we start with our intention. You know, whatever our intention is for practice. It may be to reduce stress, it may be to increase our well-being, it may be to explore, you know, a more sort of self-exploration. And we choose an object of awareness to help keep the mind present. So we've already done two exercises. The first one, what I call arriving in the present moment, this exercise of just starting to be here. And then the second exercise, which we've just done, which was some mindful movements, our intention using movement, or then just using attention through the body. So we've done actually 3 different exercises. So in this example, we could follow the breath. So we could choose to be aware of the breath as it's happening in the body from moment to moment. So we make that our intention. And we bring our attention through concentration, through opening our field of awareness, through allowing calmness and just the flow of experience from moment to moment. But then what happens is that the mind gets, wanders off, doesn't it? The mind gets taken away at some point or another, or maybe at a lot of points. Maybe every second we find the mind's wandered away. And it may be into something, it might be into worry or rumination, it might be into mind wandering, fantasizing, we might be tired, we might be going off to sleep, so that, or might be many other things. So the mind can go off in many different ways. But at some point, we will remember, we will come back, we will catch ourselves with the mind having wandered, and then we can regain our attention and we can bring ourselves back to the either the breath or the awareness of the body or whatever it is we've chosen to be our focus of awareness for that practice. And we can notice what our attitude is while we're practicing, whether we're being hard on ourselves, critical, judging, or whether we're able to bring in some of the qualities of the attitudinal foundations of mindfulness, which I've been talking about already. So there's an opportunity for us to look at how we practice. Are we being very, are we being very hard with the practice? Are we trying too hard? It's very easy to try too hard. I think I spent about the first 30 years of my meditation practice trying too hard. So, but that's what it was. But I think I'm a little bit kinder on myself than I used to be. But it's very easy to slip into that because we're used to trying hard to do something right. And it's a big mind change to step away, to step out of that and to allow things to happen. I'd like to just talk to you a little bit about some of the research that's gone on in the field of mindfulness. This happens to be, well, actually we don't need to have one. I was thinking about including a lot of information about the research that's happened, but the honest answer is now there are so many research papers coming out involving mindfulness practice in a variety of health conditions that it would actually be a whole nother lecture, which I'd be happy to do at another time. But I think the important points that we're finding is that particularly through this 8-week program of that John Kabat-Zinn developed called mindfulness-based stress reduction, which is teaching mindfulness over an 8-week period and also applying mindfulness into everyday life. So both the formal and, if you like, informal daily life practice of mindfulness. And this course, which John started in 1979 at the General Hospital in Massachusetts, in their medical department. He was a molecular biologist, that's his background. But he had a long-standing practice, and John tells a story that he was on a retreat one time, wondering what his job on the planet should be. And he puts it very beautifully. He kept asking himself, what's my job on the planet? What's my job on the planet? And the idea of the 8-week mindfulness-based stress reduction program he came to him as an idea on this retreat. So that course has developed and is now taught all over the world. And there's training centres in this country, in Bangor, University of Bangor. There's also training at the University of Oxford for people particularly involved in the mental health field with Professor Mark Williams. And there are also trainings in America, which is the one that I was privileged to do. So essentially my story with learning to teach mindfulness-based stress reduction came out of my desire to research mindfulness for my doctoral research, and this publication is the end result. But I actually started teaching this 8-week program back in 2005 to women affected by breast cancer. And I have to say, I was, to give you all courage, I considered my mindfulness practice to be pretty bare. My teacher, Sonia Morrisseau, came from a Zen tradition. It was a pretty no-frills approach to mindfulness-based stress reduction, I can tell you. And I was a new teacher, so I mean, all sorts of reasons why it should have been problematic and people shouldn't have got good results, if you like. You know, there's all sorts of potential barriers. But in spite of all that, I think the remarkable thing about this research was the results, whichever way we analysed them. And for this particular journal, we ended up having to analyse them a different way from the way I'd originally analysed them. They're very robust and they stood up. So compared to people who hadn't done the program, people who'd been through treatment for breast cancer, who'd done the 8-week program compared to a control group, found improvements in mood state, particularly anxiety, depression, fear, confusion. So it was helpful to clear the mind, if you like, to make the mind clearer. Also, their levels of vigour, more energy from the practice, physical and mental. Their physical symptoms also improved, because a lot of these women suffer from menopausal symptoms as a result of the treatment, or because the breast cancer often coincides around menopausal age. So there were many things that, compared to the control group that hadn't yet done the 8-week program of mindfulness, were very, very strong. I mean, I can honestly say, my hand on my heart, we didn't look at any of the figures before the end of the program. So for 2 years, I mean, I had good feedback. People were saying nice things about the program. But in terms of what we really found, I had no idea how the results are going to be. So, but I think what I'm really saying is I think that the practice of mindfulness as a practice to help us, all humans, in our everyday life is really quite extraordinary. And I think it gives us an opportunity to really engage in life and in our practice in a way which is quite, revelationary, really. Before I'd started mindfulness practice, I started exploring meditation. I'm 57, or nearly 57. When I was 15, or actually young, 11, I think I started exploring meditation, Indian practices, all this stuff. So I've had a really lifelong passion to wake up and to help other people wake up. And it was honestly not until I came across mindfulness by chance, I wasn't looking for it, it kind of fell over it, that, and this practice really caught my attention because it gave me so much more than, the other forms of practice I'd been doing, the transcendental meditation, other things that I'd been trying when I was younger. So, I think there's a wonderful opportunity for us to incorporate this kind of practice, and I think all the studies in different people with different medical conditions is showing this. And I've had so many people who have had relief from that's another publication. If anybody's interested in the publications, I can sort of send them to you, that's no problem, I can email them to you. But I wanted to share this quote with you. I mean, I've got lots of information from my study, but one of the quotes is this from a young woman who was in her 30s, who had been treated for breast cancer. I'll sit down so you can see it. She'd been treated for breast cancer. She had a thing called peripheral neuropathy, which comes from chemotherapy, very, very painful feet, where the nerve endings on the feet are highly sensitized because of the chemotherapy. And she had 2 young children, and she'd come on the mindfulness course. And after the first week, this is week 1, my first course I'd ever taught, she rang me up in floods of tears saying, that she was in terrible pain, that bringing attention to the present moment had made her aware of how bad the pain was, and what should she do about it. I had no idea. What should she do about it? No idea. So I just told her to keep practicing, because that's all I could, that's all I knew. I thought, there's a chance. I knew that some people had gained relief from pain through mindfulness. I didn't know whether it would help her or not. The people who have, on my courses, really engaged with the practice are people who are often in severe pain. And I've had some fantastic results, and this particular lady is one of them. I've had another lady on my most recent course who had cancer around the face, terrible pain, and again, she really engaged. So my wish for myself and for all of us is that we don't have to wait until we're in such terrible pain for us to be able to do something which is helpful for us in our lives, that we can find a way of supporting our well-being, before then, starting with the easy stuff, before we get to the hard stuff, if you like. So, I'll come back to that. I'd just like to, this is just to say, I've had many people, I can't fit all the people on one slide who've helped inform me and teach me about mindfulness, but I would like to just, for those of you who, just in relationship to this is John Kabat-Zinn, for those of you who've not come across him. And John was the man who started the mindfulness-based stress reduction program, which has brought relief to so many people all over the world. And up in the top right corner is Saki Santarelli, who's now the director for the Centre of Mindfulness. Wonderful people, and Florence next to him, who is also one of the senior teacher trainers there. I'd like to just acknowledge my Sonia Morisot, who is the teacher who introduced me to mindfulness and who is still teaching in spite of her own health conditions. So, and the many other people who have, been, I can't, as I say, it would probably be the whole presentation of people, but just to acknowledge that I feel very privileged to have had the support of people in learning, the little bit that I've already learned, and that I hope that what I have done with you this evening will hopefully enable some of you to enhance your own practices. I'd be very happy to take any questions or whatever's appropriate. Thank you. Thank you.
Thank you very much, Caroline.
Thank you.
Are there any questions from the floor?
Don't be shy. Yes.
I know at the start of your talk you more or less said, well, I'm not going to talk about the Buddhist connection of Buddhist ideas of mindfulness. Nonetheless, when one thinks about mindfulness as a sort of person aware of Buddhism, there are 2 things that come to mind. One, of course, is the idea that everything changes, nothing stays the same.
Yes.
And the other, I've forgotten what the other one is now, I've gone blank.
Oh, don't worry.
Anyway, that was...
or come back, when you think of the other one, come back. Yes, yes, the idea of impermanence.
Impermanence,
yeah, absolutely.
Yes. And so I wondered whether these ideas ever enter into, as it were, medical mindfulness, or whether they're completely separate.
Yes. I think they do, in the sense that when we do the practices, we acknowledge that things are not always the same. Because I find, for example, just thinking about the lady who was on my last course with terrible pain here, she had a particular relationship with her pain. She thought her pain was a particular way. So her relationship to it was, because she thought it was like it was, that was her kind of experience of it, partly through thought and probably partly through the actual physical sensation. So through the practice of mindfulness, she was able to separate out, she was able to leave that thought just to one side for a moment and actually be in the experience of what the pain was. And through that, she realized that the pain wasn't as bad as she'd actually thought. So in that sense, I would say, in a way, that's how the impermanence, an example of how the impermanence, comes in. And I think people, once they start to, in my experience, start to practice that, start to then see, that there is possibility, other possibilities through this.
The other thing I didn't remember was
craving,
not craving.
Yes.
So, in a way, this sort of business of not hanging on to thoughts,
yes.
moving on,
yes.
seems to be compatible with that idea.
Yes, absolutely. So this idea of our tendency to either, hang on to something or cling on to something or push it away, this very much comes into the practice of, the practice that, or when I teach it. So, because we can notice what we tend to hang on to, and if we can create a bit of space around that, then that makes situations easier. Because as we know, as human beings, we get so fixed, we get so fixed on things, don't we? That things are a particular way. And being open to the possibility of things being different, especially with illness, or with people with life-threatening illness, that can be very challenging. I've worked with, I've done groups with women with metastatic breast cancer. That means where the breast cancer spread to other parts of the body, and the outcome of that is usually death. So I've worked with these women in these groups, and seen how mindfulness can bring a shift of perspective for them, because they look at their young children, if they have, and some of them do. They're young women with breast cancer. They have young children, and they look at their children and dissolve into tears, thinking, "Gosh, I might, thinking of all the things they may not see them grow up and so on." Whereas what they can help themselves do is to switch that perspective to being present with their children now and having, living the life that they have now, rather than that kind of worrying about the future.
Just one other thing.
Yes.
In a way, the way in which the mind sort of jogs you, now move on, it says, it's a bit sort of, in a gentle way, directorial. It's almost like a kind of very gentle ego telling you to move on. And in that sense, maybe not very Buddhist.
I don't know. You any thoughts on that?
Do more sitting.
I don't know the answer to that.
Questions from anywhere else?
Karen, I find a bit of a contradiction when you mentioned about that lady. You mentioned about the lady who had peripheral neuritis of the feet, and then she was in a lot of pain.
Yes.
Then I suggested Professor, I want you mindfully to be aware of that pain. But in the normal circumstance, when you get pain in one side or somewhere, so much pain, the tendency is to sort of think of something else.
To move away.
Away from it. So it's a sort of contradiction there.
Okay, so yes, so this, thank you for that. So the practice is radically different. The mindfulness practice is radically different from what we normally do. If we have something nasty, we try to usually, as human beings, our defense mechanism is to try and move away, to run away. Something threatening happens, we move away. So this, obviously the practice isn't about standing there if there's a bus coming towards you. It's about, but it is about things like, challenging the way we look at things, and this opportunity to turn towards, and maybe just through that new, if you like, that new lens of seeing things a little bit differently. Because, does that make sense?
Yeah. Yeah.
Am I answering your question?
Yeah, that's sort of you challenge it and you take it on the front, sort of, rather than leaving it out.
Yeah. So, and that's, of course, that's a, for in the beginning of mindfulness practice, well, actually at any stage of mindfulness practice, that's always a challenge. That that coming back, turning towards the difficult. Whether it's a difficult emotion, keeping coming towards, turning, noticing what's happening in the body. That keeping on coming back is, if you like, a new habit that we need to develop as part of this practice.
Surely Buddhists already have the thing acceptance, as Buddha said, of everything that happens in the moment, whether it's good or bad or everything, is probably what you're trying to say. Is that right?
Yes.
When you say
yes.
Accept whatever happens in the moment, whether it's good or bad, or things that have happened to you.
Yeah.
You accept.
Yeah.
That the Buddha combines.
I mean, perhaps one of the things about mindfulness is as a clinical setting. I think that's probably the really important aspect of it, isn't it? I mean, it's been accepted by NICE, the National Institute of Clinical Excellence. It's practiced
in depression.
Health,
yes.
So a lot of it is related to that. It doesn't exclusively claim anything. It is related to the clinical setting of people with various clinical conditions. You had a question.
Yeah, I think it was very interesting when you started your presentation. You mentioned that this was very much what you were working on from a clinical perspective, without much connection to the Buddhist perspective. And I have had similar kind of training, not all the work that you have done, but the MBSR in Hong Kong. And that was definitely in an academic setting, but it was very much Buddhist related as well. It was part of the study. And here in the West, it seems to be it's quite important to separate these issues. And I wonder whether, have you seen any research done where these MBSR training or the effect of this training is done in a clinical setting, or where you also have the Buddhist setting, whether there are differences in the results?
Yeah, interesting question. If I can just talk a little bit about why. I mean, John Kabat-Zinn, when he started the MBSR program, the 8-week mindfulness-based stress reduction program, was very clear that he wanted a program that was going to be accessible to everyone without any barriers. And for some people, any discussion about religion or philosophy or Buddhism or whatever, the Dharma, whatever words we want to use, may create barriers for people. But what he could see with this work was that the essence of the mindfulness practice was something that was universally beneficial. So that's why I was at a conference that he was at in Chester. He was doing a day, and he said, when he's teaching MBS, mindfulness-based stress reduction, he never would mention Buddhist concepts. So that's just because that's the way the mindfulness program is, set up. I don't know the answer. I mean, I don't know of comparative studies of whether if you teach mindfulness in a sort of Buddhist setting, if you like, versus mindfulness in a say clinical setting, whether the results are different. I don't know the answer to that.
There is a question which is sort of crucial to this, that in Buddhism, or in most religions that are doing sort of calming down, quieting down, the practice of shila, morality, occupies a very central aspect. To be good is to be calm. To be calm is to be good. And so the practice itself is the practice of virtue, the mindfulness. And then there's also the practice of the paramitas, which are essentially sort of an expression of that quietness. But these are left out, aren't they? Is that correct?
Yes, they're not explicit.
It seems to me to be a problem, actually, because mindfulness is the practice of shila, actually. But then it's not mentioned, and I wonder, is it just
it's not mentioned in that context.
That people don't want to talk about anything to do with values, ethics, morals, we've tried to take it out because people might get upset.
I think it's an interesting, it's a great question, it's a great comment, and I think what I would say is that, people, I think in the way that the MBSR course is taught, a lot of these values are there, but they're maybe not explicit. That's what I would say, because it's, I mean, as an MBSR teacher, the course is only as good as my practice or my teaching, in a way. You know, if I'm not able to, you know, if you like, embody any qualities of mindfulness as I teach, it's probably not much help to the people who are, you know, doing the course. So I think things like, you know, the loving kindness practice and compassion practices, all those things, they're sort of, and the, you know, ethical issues, I think they come in the way that the courses are taught. And I think one of the problems with the MBSR course is that I respect all psychologists who are here, but some groups of professionals are thinking, oh great, there's this new trendy thing called mindfulness. Let's just see if I can, you know, have a bolt-on, do a quick course, and then I can go out and teach mindfulness to all my patients. And I think there's a real danger of that the teaching isn't coming from actually any experience of the practice, and I think that's where the potential danger lies.
Yeah,
picking up the other interesting question about the lack of controlled trials, Buddhist versus non-Buddhist.
Yeah.
There's interesting. Now, this is not a controlled trial. You'll be aware of this. Richard Davidson is doing all this very interesting work with monks, explicitly encouraging His Holiness the Dalai Lama to come along and put their head to an MRI scan and do various meditation practices, mindfulness, compassion, and so on and so on, with quite extraordinary results. I would say you get Matthew Ricard. People claim for him he's the happiest person in the world and all of that. Now that doesn't answer the question, specifically controlled trial Buddhist versus non-Buddhist, but it does say, well, if you're a long time meditator, this is pretty hot stuff that improves well-being, and presumably Davidson would say significant effect, brain structure, brain function.
Yes, that's true.
Most people in our
Sorry,
Most people here know a lot about mindfulness. When patients first come to you, they might not have heard anything about it, so how do you first sort of introduce it to them, and how do you kind of explain it? Do you give them something to read about it and then ask them to think about the program and come back?
Yeah, I mean, I have a little brochure that I give people. I've got a few here if anybody's interested. I think what we do is really talk about how it can help, rather than, you know, what the potential effects are, rather than trying to describe, you know, so much about what it is. Because as we know, it's quite, you know, you can talk about mindfulness all your life, but unless you actually practice it, you know, you're not going to have any benefit.
So I did a mindfulness CBT course.
Yes.
GP training, and I was thinking
Great.
to sort of tell patients about it.
Yeah.
But maybe if I look at your brochure.
Yeah, have a look. I mean, I think, you know, and I think one of the reasons that John Kabat-Zinn called it mindfulness, not meditation, is because of all the connotations, you know, all the ideas that everybody has around what meditation is, and, or what it's not, or, you know, stuff.
I mean, the other thing is that meditation was a very peculiar word which was chosen from the original translations from the Pali. It actually had nothing really to do with what the word actually means, which is more to do with cultivation. You know, the actual word,
Yeah.
to do with cultivation of the mind, body, spirit, and so on. So mindfulness is a very, very strange and peculiar word, actually.
Yeah.
But it's actually partly awareness and part cultivation,
Yeah.
process of cultivation and transformation. I think we've got time for one more question on the floor. Yes, at the back.
Yeah, if you was interested in further studies into history, I mentioned Bangor and Oxford. Is there any sort of local places where you
What, learn to teach?
find instruction?
Or do you want to do an 8-week course, or to learn to teach an 8-week course?
Whichever way.
Okay. There's a website. There's a website called mindful.co.uk, which has courses on it. That might be one thing. Otherwise, I would contact the Centre for Mindfulness at each of the universities, because I think There is some teacher training in London that comes via Bangor, but they do have some sort of training. But usually, if anybody's interested in teaching the 8-week program, usually the first step is actually going on an appropriate one. So, if you want more details, then I can give you some my contact details, and I'm happy to pass anything on to you.
Well, thank you very much indeed.
Great pleasure. Thank you all very much. Thank you. Thank you.